A pediatric doctor in London, Ontario, is asking the public to show compassion for healthcare workers as we enter what could be a what is a very challenging cold and flu season.
If you happen to know a healthcare worker, especially one that works in the front line, I urge you to give them your best wishes. It is a tough time for us right now. We are really struggling, and the thoughts of the public and loved ones are cherished.
So that was Dr. Rod Lim, Medical Director of the Pediatric Emergency Department at the Children's Hospital at London Health Sciences Centre. And Dr. Lim is our guest this morning. Great to talk to you.
Hi, thanks for having me.
All morning long, we've been talking about what's now been dubbed the multidemic. How has it had an impact on healthcare workers where you are on the front lines?
Oh, you know, in my 22 years in my job, this is probably the most challenging time that we've had so far. We're definitely seeing so much activity. Our emergency department is probably seeing about 80% more patients than we have traditionally ever seen in this time of year.
So what does that look like for you and for your team when it is that full, when it's that busy?
Picture the busiest airport you've ever been in, people running around basically trying to find care spaces for the children and their families, being very creative. We've opened up an entire new area where we are seeing patients. We see patients in the hallway. We're very cognizant of how long waits have become and how hard, stressful that it is for patients and their families. And
are you able to provide the same level of care that parents would have expected maybe 4 years ago when they came through?
Yeah, I mean, at the end of the day, that's our passion, and that's what we're going to do. If that ends up being in the middle of a hall, then it's going to be in the middle of a hall because we all go into this profession to care for children, and we're going to do everything we can personally and as a hospital to do that. That's just what we do.
How has the sheltering that's been taking place the last couple of years? We know globally last year flu counts were down. How has the fact that we haven't been exposed to viruses in these last couple of years affected this cold and flu season, particularly for kids?
Yeah, I mean, I think you've nailed it. I think parents always know the first time their children go to daycare and how incredibly difficult those first few months are, or if they haven't been if in daycare and they go to school for the first time. Well, as a population for the past 2.5 years now, we've been sheltered or quarantined, masked. So last year, the flu really was a non-existent entity. So we have all those people that haven't had that infection for 2.5, 3 years. They're congregating, and the virus is making an appearance, way earlier than we've ever seen. So the flu has already come, which is earlier by a month or two. And RSV is a virus that is incredibly prevalent right now, affecting young children. And we had some activity of RSV in the summer, which, again, in the 22 years that I've been here, I've never seen that as well. So certainly, the severity and the numbers that are coming to pediatric hospitals are really unprecedented.
We know that there are staff shortages, not just at your hospital, but hospitals right across the country. Pediatric doctors like yourself are saying this is past crisis stage. What solutions would you like to see implemented?
These are the problem we have now in terms of, especially amongst our nursing profession, is far beyond the next few months. I think we're really into a multi-year challenge in terms of really trying to reinvigorate and replenish a lot of the incredible nurses that have either retired or left the profession. I think we need to have very serious conversations about the way that we recruit, respect, treat healthcare workers who have given their hearts and souls over the pandemic and really haven't had that return to normalcy that a lot of other people have enjoyed over the past few months. So I think the sooner we put our heads together, the sooner that we can come up with an excellent solution. But unfortunately, we're beyond talking about a crisis for a few weeks. This is now, unfortunately, going to be something that we're going to be talking about for years to come.
Dr. Lim, I know you are incredibly busy, and that picture that you painted for us of an airport, boy, we've seen those pictures before, too. Thanks for coming on this morning.
Well, thank you so much for doing that. And again, if you can, and you know someone that's in the front line, please extend your support. It means the world to us. And we're just trying to follow our passion and take care of those patients that need us.
We hear that from you and from so many. Thank you so much.
Thank you.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.